Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah. Assalamu alaikum. In this video, I'm going to talk about methamphetamine use because in my clinical practice, I'm seeing a trend where a lot of people are now, unfortunately, using more crystal meth or methamphetamine, and there is quite a lot of complications in terms of mental health and even physical health, which people need to be aware of. So I want to raise awareness. You may have seen in the media a lot of high-profile cases of violence, including murder, which has been in the context of people abusing crystal meth. Okay. So what is methamphetamine? Well, essentially it's a very powerful, highly addictive drug that stimulates the central nervous system, okay? So crystal meth, which is a form of methamphetamine, is basically a drug that looks like glass fragments or shiny bluish white rocks, and it's chemically similar to amphetamine, which can be used for treating conditions like ADHD. So how do people use it? Well, it's commonly smoked. It can be swallowed as a pill. Can be snorted similar to cocaine, and now increasingly people get it as a powder and they'll inject it similar to how people inject heroin by dissolving it in water or alcohol. And because the high from the methamphetamine starts and fades quickly, people often take repeated doses in a binge and crash pattern. And in some cases, people take methamphetamine in the form of binge known as a run, where they give up food and sleep and continue to take the drug for a few hours up to several days. And this is very dangerous because it can make people hallucinate, develop like a psychotic type illness where they become paranoid, and often violence can occur in this context. So it's important for parents to know about this. Okay. So how does it affect the brain? So methamphetamine basically increases dopamine. And as I've discussed in previous videos, dopamine is very important in terms of a neurotransmitter, a chemical in the brain that's involved in body movement, motivation, and reinforcement of rewarding behavior. So it's essentially a reward transmitter, and the ability of methamphetamine to rapidly release high levels of dopamine, causing a dopamine surge in the reward areas of the brain, strongly reinforces the drug-taking behavior and makes users want to repeat the experience and makes treatment quite challenging. In terms of short-term effects of methamphetamine, so taking even small amounts can result in many of the same health effects as those of other stimulants, such as cocaine or amphetamines. And these can include increased wakefulness and physical activity, decreased appetite, breathing much faster, rapid or irregular heartbeat, which is dangerous, and increased blood pressure and body temperature. What about the long-term effects? So people who are now injecting methamphetamine, they're at risk of intravenous drug use related risks, such as contracting infectious diseases like HIV and hepatitis B and C. And these are transmitted through contact with blood and bodily fluids that can remain on drug equipment. Methamphetamine can also alter judgment and decision making, which can lead to risky behaviors, especially in younger adolescents and young adults, such as unprotected sex, further increasing the risk of infection. It may worsen the progression of HIV or AIDS and its consequences. So studies have shown that HIV causes more injury to nerve cells and more cognitive problems, so problems with thinking, in people who use methamphetamines than it does in people who have HIV and don't use methamphetamine. Long-term use has many negative consequences and includes things like weight loss, obviously addiction, which is what I treat, severe dental problems. So you may see patients or people who are using methamphetamine with severe decay of their teeth, intense itching leading to skin sores from scratching, anxiety, depression, changes in brain structure and function, confusion, memory loss, violent behavior, paranoia, extreme and unreasonable distrust of others, and hallucinations. So seeing things which are not real, or hearing voices when nobody's around. Okay. In terms of overdose, can people overdose on methamphetamine? Yes, a person can overdose on methamphetamine, and an overdose occurs when the person uses too much of a drug and it has a toxic reaction that results in serious harmful symptoms or death. So in the past decade or so, overdose deaths related or involving methamphetamine has increased. Um, and many of these involve opioids, especially synthetic opioids like fentanyl. So there's a fentanyl epidemic in the US, and they also kind of mix with methamphetamine uh, as a result of the overdose. So methamphetamine overdose can lead to stroke, a heart attack, or organ problems. So it's important for you to be aware and kind of raise awareness in the community about this. Addiction is a serious issue with methamphetamine. It can cause anxiety, fatigue, severe depression, psychosis, and cravings. Okay, so how do we treat it? Well, treatment is pretty much a holistic approach. If a patient has anxiety, depression, psychosis, then obviously we have medications that we use to treat that. But essentially, the gold standard treatment is talking therapies, things like motivational interviewing, cognitive behavioral therapy, which helps patients recognize, avoid, and cope with situations that likely trigger drug use. And then we can use something called contingency management, where reward is given for patients achieving abstinence or stopping the substance use. And then we have different kind of medications that we can use. Okay, so I just wanted people to be aware that this is a big issue now, crystal meth and methamphetamines use, and in particular highlight that if patients use or people use high quantities, it can lead to distortions of reality, so their mind kind of becoming paranoid, and it can be an increased risk of violence to family and friends. So it's very important that if you are aware of a family member or friend who's using methamphetamines, that you seek treatment for them and seek expert input as soon as possible. Until next time, this is your brother Dr. Abu Isa. Assalamu alaikum wa rahmatullahi wa barakatuh.